Hi everybody, Dr. Daniel, and today I'll be talking about abdominal migraine, which is a weird situation because the abdomen is down in your stomach area and migraine comes from the brain, but it's a turn on of the gastrointestinal fibers through the vagus nerve mainly in the brain that sends a signal down into the abdomen that causes all the symptoms. And of course migraine, plain old migraine itself, comes with nausea, vomiting, sensitive to light, and stuff like that. Abdominal migraine is mainly a pediatric childhood condition. It develops in children aged 6 to 9, mainly girls, because migraine is in girls 3 times more than guys that have it. It doesn't have headache associated with it, which is surprising, but it has all the GI symptoms: nausea, pallor, vomiting, just feeling ill or sick or down. It comes on suddenly, kind of like migraine does, and can put you in bed or miss school or work. Of course, as children, they're not working, but they miss school. As these children grow up and become older, they develop plain old migraine, which is about age 20. And that'll last till 55, 60 or something like that, and then dramatically decrease. Although some persons still have migraine up in 70, 75, 80 years old, but the headaches are very low level at that time. The things that can set it off, the usual things that set migraine off: stress, not eating right, not sleeping well, glaring or lights, an irregular schedule, things like that, missing meals. There was usually a family history of migraine in these people because they're going to have migraine anyway. And triptans can be used for treatment. They mainly use elatriptan, sumatriptan, or rizatriptan, just like you use in adults. They can be taken at onset and it'll help the symptoms. Also, you can use an ice pack, put the child down, put them in NPO so they don't eat or anything like that. You can use drugs like amitriptyline, topiramate, Depakote in mainly boys, beta blockers like we use for treating migraine for prevention. And again, as I've said earlier, these children grow up to be young women mainly with plain old migraine. Now, another thing to add about this subject is that some older migraineurs, women 20, 30, 40 years old, or men at that age if they have it, can have the similar abdominal migraine symptoms without having headaches. So it doesn't completely disappear between the ages of 6 or 9, but it usually does. It's mainly considered in literature and clinically as a childhood event. So thank you very much for listening to me today. Please click on like and subscribe down there. Keep watching on YouTube on my channel so you can see other talks that I have on migraine. God bless all you folks who have abdominal migraine, and I'll see you again on the next talk.